The first winter without the COVID-19 restrictions, and the British hospitals, believe it or not, are struggling. Doctors are reporting a sharp 40% rise in the number of admissions, with people who are getting admitted with influenza. The NHS has said that 95% of all acute beds are now filled by emergency admissions, caused by what it has described as a perfect storm of winter pressures. Take a look at this report.
Winter sickness means hospitals across the United Kingdom are again under pressure, and this one, Alderhay Children's Hospital in the north of England, is no exception. This year, though, it's far busier. It says there has been an increase in the number of youngsters under the age of 5 being admitted for RSV, a respiratory infection. The number of children admitted to hospital with RSV has increased 12% compared to last week. 9 in 10, 89.6% of pediatric intensive care beds were filled by children last week, 5% more than last year. Dealing with seasonal illnesses is expected to become more difficult as planned strikes in the United Kingdom's National Health Service takes effect. NHS England is describing the problem as a perfect storm of winter pressures. 5-month-old Clementine just arrived at the Accident and Emergency Department. She's had difficulty breathing for weeks now. Her parents think she has bronchiolitis, a swelling in the small tubes of the lungs.
She gets little temperatures. She just can't seem to regulate herself to be back like to a normal happy little self and drinking her bottles, and it's just so hard, especially over night time. It's like she can't breathe, her chest tugs and everything when she's trying to get like a breath in, and it's just really difficult.
Baby Clementine will have to spend the night here. There's a bed for her, but the staff are finding it hard to ensure everyone is cared for.
So our figures do show that it's the highest rates that we've got documented that we've ever had. We have lots of plans in place in terms of the ways that we work, in terms of making sure that we are seeing and treating the sickest children, and everybody that needs to be seen is seen. And this is something that is an ongoing problem across the NHS. But yeah, we see every child and make sure that they're in the right place and having the right treatment.
Health services officials are hoping to ameliorate the problems of bed shortages by identifying and coordinating patients with hospitals that still have capacity.
We are able then to make decisions to support hospitals, for example, by diverting ambulances from a hospital that's really busy to one that may be a little bit quieter. We can also organise mutual aid between organisations.
The surge in hospital admissions seems to bear out many months of warnings by doctors who've been urging people to get the flu jab. Bureau Report. WION World is One.
WION is now available in your country. Download the app now and get all the news on the move.